Hello students, welcome to my channel. So today we're going to discuss about 8th unit in biochemistry, that is immunochemistry. So the first one is immunoglobulin. So what do you mean by immunoglobulin? So immunoglobulins are also known as antibodies. So it is produced by plasma cells, or it binds with antigen such as bacteria, virus, then it will destroy. And it is, if you see, it is Y-shaped protein. It identifies foreign objects when it is enters into your body, like antigen, so in the blood and through the immune system. And these antigens or toxins, it will induce the immune response, that is the antibody. So now we'll move on to the classes of antigen. The first one is the T cell independent antigen. So it stimulates directly antibody by B cell without interference of T cell. That means it depends only the B cell and it won't get help from the T cell. And another one is the T cell dependent. So if you see, this antigen generate an immune with the help of both B cells and T cells. Now we'll see about the structure of immunoglobulin and their functions. So the first one, it is a glycoprotein, and second one, it belongs to the globulin. So we are calling as the immunoglobulin. So globulin is one of the amino acid that consists of protein, and they are Y-shaped molecules. And if you see, you have two chains. One is heavy and another one is the light chain. Okay, the light chain that is made up of 214 amino acid, and heavy chain, this is made up of 446 amino acid. And if you see the light chain, this is linked with the heavy chain, so that is by disulfide bond. So can you able to see the picture? That is, two sulfide is there, it has been joined together. Okay, so that is the disulfide bond. And another one is the central region of heavy chain. You can able to see the hinge chain, that is a hinge region. So this is the hinge region joining both the central region of a heavy chain. Okay, then you have Fc. So Fc, this is meant for the biological activity of the antibody. So what it will do? Fixation and phagocytosis. So what do you mean phagocytosis? It is killing, engulfing the bacteria when it is entering inside the body. Okay, the next one is a light chain. So you have two types are there. One is kappa light chain and another one is lambda light chain. And you have heavy chain, that you have 5 types, that is gamma, alpha, meta, delta and epsilon. Okay, next move on to the important things. So why do you want to study biochemistry? Then you will have the question then, what do you mean by immunoglobulin? So how it is helpful in medical field? Okay, now let's see what is the importance. Okay, the first one, immunoglobulin therapy. This is used in various conditions and also for the treatment of immune deficiency and also autoimmune disease. And next one is hepatitis B. Have you heard of hepatitis B vaccine? So that is hepatitis B immune globulin. So this is administered to the patient after exposure to the hepatitis B virus patient. So accidentally, if you have needle prick injury in the hospital, so there is a transmission of chance for hepatitis B virus. So that time immediately this hepatitis B immune globulin will be given. Okay, and next one is tetanus. I think you all know about the tetanus immunoglobulin. So this is given for prophylaxis of tetanus infections to the patient if you have any puncture, wound and injuries in case of any accidents and any injuries to the body. Next example, Rho-D immunoglobulin. So it is given to Rh negative females during the pregnancy in order to prevent Rh immunization against their Rh positive fetus. So what is the meaning for this? Suppose if the mother get pregnant, so the mother is having Rh negative, that is for example A negative, And if the mother is delivered the baby is having the positive, so that time this anti-D, otherwise called RHOD, this immunoglobulin will be given. So why they are giving? Because their antigens will be reacting inside the blood of the mother. So that's what they are giving. So the second pregnancy will be difficult and that second baby will be dying. So because of this, RHOD immunoglobulin is given. So if you see, you will have some of the side effects, that is adverse effects are there. What are they? So they will have headache, local injection site reaction, fatigue, fever, chills, myalgia, there is a muscle pain, arthralgia, nausea and vomiting. And contraindications to whom you should not give, suppose if they have a high risk for hypersensitivity, so you should not give this immunoglobulin therapy. Next we'll see the type and functions of immunoglobulin. So the first one, IgG. So it is an antibody with a heavy chain. So it is a glycoprotein and is also Y shape. So it has a 2 light chain and 2 heavy chain. And then if you see the normal serum concentration is 8 to 16 mg per ml. So you have so many types for them. That is G1, G2, G3 and G4. Function of IgG. So it crosses the human placenta and thus offers a passive protection to the newborn for about 6 to 9 months. That means no need to give any other from the outside. And what is the next one? Opsonization. So it is an immune process that makes pathogens and other foreign substances for destruction by the immune system.